Health Novo presents Sushruta, our health awareness channel.
Last couple of years, when you go for a movie in a theater, or when you're watching a movie on the television or anything on the television, you see one government of India, one information comes in, and that's about oral cancer. You see somebody's having a dirty face outside, and they show a lot of things in the mouth. This is the advanced stage of oral cancer. People usually ask what are the symptoms of oral cancer. There are symptoms means what the patient complain. Signs means what the dentist see. So there are two different things. And I would like to talk to you about oral cancer in detail for a very simple reason that India has got maximum oral cancer patients. The reason being, of course, chewable tobacco, smoking, gutka, and the irreversible bidi. That means the burning part of the bidi goes inside the mouth. That's usually in Andhra Pradesh also. Friends, oral cancer doesn't come overnight. There is a condition called pre-cancerous condition. I myself is a specialist in oral cancer. That is, I've done my oral pathology in my basic graduation, post-graduation. So friends, oral cancer can be prevented. The question is how? Well, everybody will say, okay, doctor, you will tell me to cut the habits. Don't eat gutka, don't eat tobacco, don't do this. Well, friends, I can't tell everybody or can't force the educated person or intelligent person to stop. They know when to stop. But I would like to show you in your mouth that if you have this particular thing, your expiry date is there. So what are these things? If you are using tobacco and lime, usually you see people doing this and they keep it in one corner. And they get a kick because salivation comes in, they get a kick. Now that particular area which is pink in color becomes a little bit of darker, then becomes grey, and then you get a white patch. And that white patch is called leukoplakia. That means it is a pre-cancer region. And if you see that white patch, you don't have to go to a dentist. If you see that white patch like doing like this, you have to stop the habit immediately, go to a doctor, remove that white patch, you will never get cancer. So if you remove that when it's just beginning, called pre-cancerous condition, and please remove that and stop your habit. If you don't, doctor will tell you, okay, your life is this many years. Same thing happened with bidi. You're smoking, you get a patch on the tongue or on the cheek because of the heat generated. The blood circulation goes, you got a patch, and that patch is called precancerous condition. If you eat gutka, your cheeks are very soft. The moment you start eating gutka, which contains supari, maybe tobacco, somebody says that, well, my gutka doesn't contain tobacco, but supari can cause problem. That supari eating all the time makes your cheek, soft cheek, firm and firm, and that we call as submucous fibrosis. Your mouth is opening this much, then it becomes this much, then it becomes this much, then it becomes this much. And when it becomes this much, you can't open your mouth, and if there is a sharp tooth rubbing against the cheek, you start getting ulcer. And that particular ulcer, which is painful, becomes painless and converts into a cancer. So your submucous fibrosis can give you cancer. And the last is tension. If you take too much of tension, there are white lace-like appearance on the cheek, on the tongue, on the gums that we call as a lichen planus. The incidence of lichen planus to cancer is less, but that lichen planus gives burning sensation. It is sometimes red, sometimes white lace-like. That is also pre-cancerous. You'll be surprised. I got a patient, which I've written in my book also. She had this type of lichen planus called pre-cancerous condition. I took all the history And then her daughter-in-law said, "Doctor, 6 hours a day she is front of television." Then I talked to her. She said, "I take the tension of the episodes in my head." That means the tension which is there on the television, on the movie, on the daily soap operas, that's giving her tension, and that tension can cause problems in the mouth. So friends, the symptoms is what, if you tell me the symptoms, that means it is gone. You have to check the signs. So you have to visit the dentist very often if you've got habits, or check yourself. If you get a white patch, please remove that white patch. One will never get cancer. So that's about oral cancer and oral pre-cancer. And if all over this country, if we can diagnose through patient themselves the pre-cancerous condition and advise them to visit a doctor or a hospital where they can remove that patch, I think we don't have to spend a lot of money on major operations. And well, everybody knows there is no cure for oral cancer till now.